Maybe the last time you had a pimple you were still in high school. But now you are pregnant and instead of the famous pregnancy glow, your face is covered with acne. What happened to that clear skin you were so used to? Let's take a look at what happens to your body when you're pregnant. Can it actually cause acne? Up to 42% of women have acne during pregnancy. In addition, nearly 50% of pregnant women visit skin clinics with inflammatory skin problems including psoriasis, rosacea, and eczema. The risk is even higher among women who have a history of acne or oily skin. Acne can develop or become worse during any period of pregnancy. Although it is commonly believed that acne is most common during the first and second trimester, recent studies suggest it is more likely to occur during the third trimester. What exactly causes pregnancy acne? 1. Increased activity of oil glands. Oil glands called eccrine and sebaceous glands tend to have higher activity during pregnancy. Typically, this occurs during the last few months of pregnancy. 2. Increased androgen levels. Increased androgen hormones can lead to increased oil gland activity and lead to a vicious cycle. Typically, this occurs during the third trimester. Some general guidelines to follow when you have pregnancy acne. Wash your skin twice daily with lukewarm water and gentle cleansers. Do not use scrubs or any cleanser that contains beads. Even though the beads may be tiny, they can cause skin irritation and increase inflammation. Experts at the American Academy of Dermatology (AAD) suggest starting with topical medications such as OTC glycolic acid and facial washes if needed. Protect your skin from potential sunlight-induced pigmentary damages with a broad-spectrum sunscreen with SPF of 30 or more. Regularly clean your hair with a mild shampoo. This might help reduce acne around your hairline. Avoid picking your acne. Avoid dairy and high-sugar products as they might make your condition worse. Milk is a great source of calcium and avoiding it during pregnancy can affect the development of your baby's teeth and bones. Thus, you should go for an alternative source of calcium such as almonds, broccoli, edamame, chickpeas, pinto beans, tofu, spinach, and calcium-fortified foods. You might opt for a calcium supplement after consulting with your doctor. In addition, yogurt may be less likely to cause acne problems compared to milk. If the symptoms do not improve with these approaches, you should consult a doctor. Your doctor may prescribe topical antibiotics including erythromycin, clindamycin, azelaic acid, or metronidazole to help fight stubborn acne. Among these topical medications, experts say azelaic acid is perhaps more advantageous in treating pregnancy acne because it has an added benefit of improving blemishes. If your acne does not respond to topical antibiotics or becomes worse, your doctor may prescribe oral azithromycin, erythromycin, or cephalexin. All of these oral antibiotics have an excellent safety profile for use in pregnancy. Rarely, for severe cases, they may want to use oral corticosteroids to help with inflammation. In addition to antibiotics and topical medications, taking a zinc supplement, particularly zinc gluconate, might be a safe alternative for both pregnant and breastfeeding women. It primarily benefits those pregnant women who already have a zinc deficiency, which is estimated to be about 80% of pregnant women around the world. The current recommended dietary allowance for zinc during pregnancy is 11 mg per day. Chemical peels that use lactic acid and glycolic acid are generally safe. While salicylic acid peels can help treat acne and decrease oily skin, it is not recommended in pregnant women. Peels that contain salicylic acid can lead to miscarriage and birth defects, especially if a large area of skin is treated. Acne treatments to avoid during pregnancy. The AAD strictly prohibits the use of the following medications during pregnancy. 1. Retinoids including isotretinoin brands, Absorica, Amnesteem, Clarivis, Myoricin, Sotre, and Zenatane. Isotretinoin has severe teratogenic effects, which means it can affect the development of an unborn baby when used by a pregnant woman. The risk is even higher when you take it in the first trimester. 2. Tazarotene brands, Avage, Fabior, Tazorac, and Zirac. This topical medication belongs to the retinoid class of anti-acne drugs and carries similar risks to the fetus. Though the risk of birth defects is higher with oral use of retinoids, topical retinoids can also cause defects after absorption through the skin. Therefore, it's best not to risk it and avoid retinoids altogether. 3. Spironolactone brand, aldactone. While spironolactone can help decrease androgen levels and improve acne, it is not generally recommended for pregnant women. Animal studies have shown that spironolactone can cause fetal abnormalities. If you are taking other medications for acne, make sure to check the label for pregnancy information. Acne after pregnancy. It's very hard to tell how long you will have to struggle with those annoying zits after delivery. You will likely get rid of them once your hormones return to normal. Because every woman is different, it could take a few weeks or even months before your hormones reach their pre-pregnancy levels. As with acne in general, it is important to continue taking care of your skin. Don't immediately drop the skincare regimen you've been following during your pregnancy. Acne during breastfeeding may not be as common as pregnancy acne. But nearly 20% of women experience acne during the first 5 weeks after delivery. If you want to read more about pregnancy acne, go to acneeinstein.com.